On the day of your surgery, the treatment itself only takes 10 minutes from start to finish. We will start by giving you some brief post-operative instructions as to what to do after your surgery. We will place an antibiotic drop in each of your eyes as well. I will perform a brief eye exam, and then we will lie you down on the laser bed. We will slide you underneath the laser. At that point, I will instruct you to open your eyes and look, and in some somewhat bright lights, there will be a flashing red light. That will be your target to look towards. I will coach you the whole time towards looking at that target. We will place a sticky dressing over your eyelashes to help keep those out of the way. We will put a little lid holder on your lids to keep the eyes open. We will then place some mild pressure on your eye. Your vision will go a little bit dim or dark. That part will last less than 10 seconds, and I will walk you through that. When that part is over, we will have you again refocus on the flashing light. The flashing light will seem a little more blurry, and I'll have you concentrate looking towards the center of the flashing red blur. The laser treatment itself will then begin, which will only last for a matter of seconds. When the laser treatment is over, we will gently replace your flap, and we will slide you out from underneath the laser bed. We will have you sit up, at which point in time you'll be able to open your eyes and freely look around. The vision will seem a little bit foggy when you sit up, but it'll be crisper in the fog. At that point, we will place some sunglasses on your eyes, instruct you to go home and take your nap, and not touch your eyes is the most important rule after surgery, and make sure that you are all set for your post-op appointment the next day. The procedure in total, again, is less than 10 minutes from start to finish, and I walk you through it. For most people, the worst part of the procedure is the anticipation of the procedure. Once we get started, it really goes by very quickly.
I've been wearing glasses and contacts since I was 16 years old. So glasses, of course, are always bulky. They pinch your nose, they hurt. Contacts, one falls out and, well, you're blind. They get dry, you carry around drops, and when you travel, you carry so much stuff for your eyes. But then I thought, you know, I want to see better than I do now. I would highly recommend Dr. Travers to do anyone's surgery. I had heard her name and then got on the internet and started researching doctors, and she has excellent accreditations, lots of good testimonials, people that are happy and pleased. I didn't see anything negative. I like that. It's amazing the things that I'm seeing. I'm seeing things more than I saw with contacts. I see more than I saw with glasses. I am so pleased with everything she did, and she herself is very good at explaining everything. I found that comforting in a doctor. You just need to be comfortable with who you're going to see.
Travers Lasik Vision Care is proud to offer patients the most advanced technology available, starting with the Z-Lasik. Z-Lasik is blade-free. This laser is the first compact mobile femtosecond surgical laser, and unlike other methods of laser vision correction, Z-Lasik employs all laser technology throughout the entire procedure. Bladeless Z-Lasik uses a highly precise laser to create the flap, which better controls the thickness and accuracy of the flap. For some patients, especially those with thinner corneas, the flap thickness is very important. Z-Lasik offers improved safety, high-definition vision clarity, and more accuracy than any other laser in its class. Patients can enjoy a faster recovery time, less post-operative discomfort, and better results than ever before. The Alcon WaveLight 400 IQ. This new FDA-approved platform laser was designed right from the start. People undergoing LASIK or other refractive procedures with Alcon WaveLight will benefit from the laser's unique ability to reshape the eye while compensating for the cornea's naturally aspheric shape. Unlike older excimer lasers, which remove eye tissue in central flat manner that creates an edge, Alcon WaveLight's perfect pulse technology uniformly applies tiny pinpoints of laser pulses adjusted to each eye's specific curvature. With this unique system, eye tissue is reshaped in a smooth, consistent manner that provides the very best vision result. For one thing, the Alcon WaveLight can treat a larger area within the eye's targeted treatment zone. This means a greatly reduced chance of side effects such as seeing halos around headlights and bright lights at night. These side effects can occur at night, or in darkened rooms when the eye's pupil widens and expands beyond the area of the cornea that received laser correction. Wavefront measurements provide meticulously detailed information that can help eye surgeons address even obscure defects in the eye's optical system, known as the higher order aberrations. The Alcon Wavelight laser was designed by Wavelight, the company that pioneered wavefront technology. The Bausch & Lomb's iOptic system is for personalized laser vision correction and is the newest generation excimer laser. To better understand your particular vision and any impairments you may have, the iOptic system maps thousands of data points, giving a fully detailed three-dimensional picture of your cornea's shape and characteristics. This leads to a unique treatment for each eye, resulting in personalized vision correction. Your eye is as unique as your own fingerprint, with its own special shape and complex characteristics that make it unlike any other. The best treatment is one that is unique to you.
The surgery itself is usually about 10 minutes from start to finish and is really over with before you know it. Is the surgery safe? And the answer is yes. There is no surgery that comes without any complications, but the complication rate is extremely low with LASIK surgery, and most of the time when those complications occur, they do not affect your vision long term. Patients report very little to no discomfort during the surgery. Most patients see clearly the very next day. The vision is usually good enough to drive themselves in for their appointment the next day, to return to their normal activities, to return to work. It's really a very quick visual recovery process. To determine if you are a good candidate, you need to be at least 18 years old, your prescription needs to be relatively stable over the past 2 years, and you need to have healthy eyes. For the first couple of months after surgery, people will have some mild symptoms. The most common things we see are a little bit of dryness in the eye. You may notice that the vision fluctuates, not a large amount, but you'll notice some minor fluctuations in the vision. You may notice at night that you get a little more glare and halo than what you're used to. All of these symptoms usually will dissipate. So once we get about 2 months out, that's when most of the symptoms are gone. The brain gets used to your new vision, it normalizes your vision, and that's when we tell people we're reaching the end point or your final result. And that's when we ask, are you happy with your vision? And if you are, great, we're done. But if not, in a very small percentage of people, we can go in and fine-tune it.
Dr. Lori Travers is the most experienced LASIK doctor in the Triangle.
I had my LASIK eye surgery over 8 years ago, and it's one of the best things I've ever done in my life. The most common comment I hear after surgery is, why didn't I have this done sooner?
Travers Lasik Vision Care offers all-laser Z LASIK with high-definition vision clarity.
I'd recommend going to Dr. Travers to anybody. The personal one-on-one attention and the great price and the great service, I don't know why you'd go anywhere else.
Schedule a free consultation with Travers Lasik today.